Dear friends, my name is Dr. Igor. I am clinical oncologist practicing since 2010. Today we are talking about antiparasitic drugs against cancer. Let's get started. Antiparasitic drugs can really affect cancer cells. We know this. We have a lot of clinical and preclinical data for now. That is not because as somebody thinks that all the cancer is because of parasites. No, some cancers are because of parasites, but mostly not. If we take cancer cells in their laboratory, no parasites there, just growing cancer cells, we add antiparasitic drugs, they will be killed. Because these drugs can affect the cells, the living cells. They can affect parasites because these are living organisms consisting of cells. They can kill tumor, which contains of cells also. And they can affect our body, of course, because we also contain of living cells. Can you imagine how difficult it is to develop a new anti-cancer drug? You need to make the theory, you need to develop this drug, you need to study it on cells, on animals, you need to study it on humans to see how it's absorbed, how it's distributed, is it toxic, what are the contraindications, what are the adverse reactions, etc. And it takes a lot of money and it takes a lot of years, 10 years at least. It is much easier to take some drug that is available and redirect it. See, what if this drug will work against the other diseases? Because there is no single drug or substance that will affect only one point in our body. Everything affects many points. There are many receptors that are similar in different organs. Even, for example, TSH, thyroid stimulating hormones. Thyroid, it stimulates thyroid. Not only. That was discovered as a thyroid stimulating, but it can stimulate a lot of receptors everywhere, even in bones or in immune cells. The same here. We take antiparasitic drugs and redirect them onto something else. Here, onto cancer cells. We have a lot of data now that tells us that really they can affect cancer cells in the similar mechanism like they affect parasites, but also some other different mechanisms. What can antiparasitic substances, drugs do? And the best thing, we already know a lot about them. They are already registered. We have a lot of clinical trials. We know the toxic doses. We know how they are absorbed. We know how they are removed from the body. We know what are their, for example, side effects, contraindications. That's why it's very time and money saving to investigate them. We just need to get some additional information. And really, we know that they can induce apoptosis, induce ferroptosis, they can affect autophagy, they can affect mitochondria that are energy producing factories of our cells. If energy is not produced, the cell dies. They can affect the glucose metabolism. Cancer is very dependent on glucose metabolism because cancer is very resistant to low oxygen. Because cancer grows fast, there is often not enough oxygen coming and it needs to survive. In low oxygen conditions, not enough energy is produced because one molecule of glucose without oxygen gives very few amount of energy. But if you have oxygen, it gives a lot. That's why in this hypoxic condition, low oxygen condition, the cancer cells will need a lot of glucose to function, to grow. Antiparasitic drugs, like for example artemisinin, can affect this process in cancer cells. The anti-cancer activities are already studied in many types of cancers, including leukemias, lymphomas, colon cancer, breast cancer, gliomas, etc. And artemisinin will decrease the resistance of tumors to low oxygen. What if we combine this artemisinin with some techniques like TACE, like transarterial chemoembolization? We put the catheter through the blood vessel, we go to the tumor blood vessel that feeds the tumor with blood, and we clog it. In general, this procedure is often not very effective because tumor has a lot of other small blood vessels, for example, and it's very resistant to low oxygen. But if we use, for example, artemisinin, it will decrease the resistance of tumor to low oxygen. It can theoretically improve their effectiveness of this method. We just need to investigate it. Unfortunately, there are some problems with artemisinin and its derivatives, because when we inject it, its effective concentration falls very fast, and its concentrations will drop dramatically after 20 minutes already. That's why it's not enough time to act well on tumor. In general, in clinical trials, 18 milligrams per kilo of artemisinin was quite well tolerated. They injected it on day 1, then day 8, and then day 15 is already free day, and then again day 1, day 8, like cycles in chemotherapy. Or it can be given through mouse in dosage 200 milligrams per day. Among complications, mostly it's anemia, but it's quite well controlled, not very severe, and it can be some toxicity to neural system, especially to ear. So it can cause some mild hearing loss or some lightheadedness, I mean vertigo, like dizziness. There are actually phase 2-3 trials on cancer patients with colon cancer using artemisinin together with conventional treatment, but we still don't have any results. And the scientists are working on developing new forms to improve its delivery to tumor. Wish best of luck for the scientists, and let's go to the next drug. It's albendazole. We know that albendazole is quite well tolerated. Even the dosages up to 2.4 grams per day are considered to be quite safe. And most important, we reach effective concentrations in blood. Similar concentrations what we got in our preclinical studies, without any severe toxicity. This is very important. Fortunately, there are no clinical trials with albendazole now, but there are clinical trials with its brother mebendazole. Good thing, it's also well tolerated and it also reaches good concentrations in plasma. But all the clinical trials nowadays are still recruiting and still no results are available. Let's wait. By the way, most clinical trials, they focus on brain tumors. One more, ivermectin, very popular remedy, very popular antiparasitic, and against COVID, many doctors recommend it. It's well tolerated, it's quite safe, and we can reach good concentrations also. Unfortunately, no clinical trials available for now. But we have a lot of clinical trials of chloroquine and its derivatives. It's anti-malarial drugs. For example, one trial where 30 patients with glioblastoma multiforme took part, it showed that combination with conventional therapy improves their survival. There is one more clinical trial going on now. They study temozolomide or radiation therapy plus this drug, but there are no results available yet. Niclosamide, other drug, antiparasitic, it can affect mitochondria, the energy-producing subcomponents of our cells. If there is no energy, the cell dies. Unfortunately, that can affect our muscles, especially cardiac muscle, especially our heart. That's why we are concerned about the toxicity to the heart. Also, there is a clinical trial that says that 500 milligrams 3 times a day is quite well tolerated, but we have some problems with concentrations. Only 1/3 of patients achieved good concentrations like we saw in preclinical studies that showed that it really helps against tumors. That's why scientists are struggling with improving its delivery to tumors now and protecting of heart. Nitazoxanide is another drug. There is a clinical trial ongoing now, but we still have no results. In conclusion, I can say that most likely if we use these drugs as a single remedy, it won't give us a lot of effect, but they all will affect tumor and they all will decrease its resistance to our conventional treatment methods. That's why combinations must be very promising. We just need to study it and to understand which doses are needed, how to inject them, for example, how to combine with conventional drugs, what tumors will be more sensitive to these drugs. That's why let's wish a lot of luck to our scientists and hope we will get a lot of good data in future. And as for me, they should study albendazole, mebendazole and ivermectin first, because you see they are not really very toxic and you can achieve good concentrations without any problems. That's why they would be the easiest to use in clinical practice. You don't need nanoparticle or special technologies. Thank you for your time. Thank you for watching. I wish you all best. Good luck. God bless you. Bye bye.